Welcome back. I'm Dr. Angela Servis, and this is
I'm Felix, ACP Relieving. Hi.
Hi. And Felix, today we are going to be talking about erectile dysfunction, right?
Yes, yeah. So big topic of discussion in TRT, and often a primary cause for concern, and maybe the first thing that is noted for guys that come to see us.
Canary in the mine, so to speak.
Yeah.
So I think as a GP, erectile dysfunction is actually a really important thing to discuss. Partly because if a guy comes in to talk to you about erectile dysfunction, like immediate alarm bells go off. I want to check the guy's HbA1c. I want to do blood pressure. I want to be looking at all his cardiovascular risk factors and everything as well, because actually the most important thing for him is his erectile function, because he won't necessarily know that it actually comes with a really high cardiovascular comorbidity. So it's an important opportunity as a clinician to try and engage this guy, take him seriously, and address his concerns and everything as well.
Yeah, for sure.
So, in the sphere of men's health in the clinic, I always say to guys, I think about, it's almost like a pyramid for me. I think about hormonal health, nerves and psychological stuff, and cardiovascular stuff. I mean, in big handfuls.
For sure. Yeah, and they often have an interplay with each other, don't they?
Absolutely. And I think sometimes, even if you manage to get, if you find people are testosterone deficient and you get them back into hormonal health, so to speak, sometimes there's all sorts of other stuff going on. They might have sort of metabolic syndrome type picture going on. You might have some HbA1c, or they might be sort of insulin sensitivity have become a problem as well. And also they may well have had 5-10 years worth of erectile dysfunction that has been hormonally driven. And then it becomes a head issue.
Yeah, for sure. And that's where the psychology can inform the physiology, can't it?
Absolutely.
That is a hard cycle, washing machine cycle to break out of, even if you optimize their hormone levels.
Absolutely. So, I mean, I think it's a blessing and a curse. One of the real difficulties nowadays is that it's so bloody easy to go onto the internet and people will just go, erectile dysfunction, Viagra. And they'll buy it and they won't know anything else. They won't have checked out any of their other risk factors because they're not thinking about it, because people don't hear erectile dysfunction. I might be having, I might be a sitting duck waiting for a heart attack.
Yeah, I might have peripheral vascular disease.
Exactly.
Nobody thinks that. There's a pill for that.
And all this stuff that's so reversible, and that there are so many risk factors that you can reduce, and so many things that you can do at that early stage, just gets kind of, the warning sign just disappears because you've got Viagra, and that small short-term solution to one element of the issue there gets solved. So when guys come in and that's what they want to talk about it with you, what's your approach to it?
Yeah, so very similar to yourself. Like, the first thing I want to establish is, do they have any increased cardiovascular risk? Is that secondary to other comorbidities like metabolic syndromes? Are they overweight? Are they a smoker? Is there an increased likelihood of peripheral vascular disease? Do they have sleep apnea? Have they been assessed for that? And then lower down on the list is this a neurological issue? Is there actually something to do with their spinal nerve innervation that is causing this to be an issue, which is much rarer than vascular issues and psychological issues. The most common one is psychological issues, because like you alluded to earlier on, you may have dealt with this problem for 10 years plus. And this is the first time you're approaching someone going, do you know what, this is actually debilitating. I can't be intimate with my partner. I can't do X, Y, Z. And you want to get it sorted. And people are looking for that quick solution, that quick fix. And that's where the internet and Google and Viagra, comes in. And you're right, it is a quick fix. It's like putting a Band-Aid on a gaping wound and it's snapping, and then repeatedly putting that Band-Aid on and it's snapping without actually going in and doing, for want of a better analogy, a mattress suture to make the wound heal from the inside up and out.
Absolutely.
So when I very similar to yourself, and I look at their other risk factors and do a full comprehensive workup for them, and then I very much steer them away from sildenafil, which is the pharmacological name for Viagra, purely because I don't like how imprecise it is. So it definitely does the job it's supposed to do. It's a PDE5 inhibitor. It will vasodilate, but the problem with that is just on a very superficial level, it vasodilates everywhere. And it's a big dose. Like the one way I described it to a patient once, and I don't know if I heard this from someone and I've got it from somewhere, but I think it was me that came up with it. It's like using a blunderbuss to shoot a target 2 miles away when there's a medication that could be like a sniper rifle. It's just like a pow, everything's being dilated. And what that manifests in for most guys is a pounding headache, a horrendously congested nose, which they then start going to get over-the-counter things for like Octarine and like sprays and things. You're like, no, it's not, if there's no mucus in there, all of your blood vessels have become massive, which is why it feels like your nose is blocked. But they do have improved erectile function, so they're like, okay, that's all I can do.
Completely distracted by all the side effects from it.
Because they're overjoyed at the fact that they've managed to have some erectile function. Now, there are much better, more precise PDE5 inhibitors out there that have way more benefits. And my first go-to is Tadalafil. So as the name suggests, it's in the same family. You've got sildenafil, aka Viagra. Tadalafil, most people know it as Cialis. But that second one is so much more fine-tuned. That's the sniper rifle to hit that target, because you're not only, when used properly, are you getting the outcome that the patient wants primarily, which is to have improved erectile function, but you're minimizing all the other negative, and I don't like calling them side effects because it implies that they're unexpected. I call them negative treatment effects. We know they're going to happen, so we need to look at what the options are to reduce those or minimize those as much as possible for patients. And it does, and it's all about, again, the way you dose it. So using it not in its traditional manner where it will say on the box, take 60 to 90 minutes before planned intercourse, if that's a thing.
Schedule things,
Let's schedule that in for Wednesday night. And then make sure you take 20 milligrams before, sometimes up to 40 for severe dysfunction. No, that's not a good way or a good use of that drug. It's certainly not optimal in my experience. I'm a much bigger fan, once I've ruled out all the other sinister causes of this issue, and we've corrected everything else that we can correct. They've been assessed for sleep apnea. They've stopped smoking, for example. They've optimized their weight. They exercise regularly, and they have everything in place. Then I like to use Tadalafil in a much sort of more, and we say this word a lot, don't we, get spanned about, in a microdosing manner. So I like to use 2.5 to 5 milligrams every day, and it confers not just the benefits of improved erectile function, but so many others. And I don't know if you've seen the same.
Yeah, no, absolutely. And I mean, the ability, even just going back to that reassuring process of normal spontaneous erections and everything, and that just returns men's confidence in their own physiology. It's something that they've experienced probably for as long as they can remember, and then it suddenly disappears, and that makes them more cautious about things and loses the confidence sexually. But I think also getting back to that natural rhythm, I think, is really important for a lot of guys as well, because it once they've got confidence that that's happening, then they'll feel confident that it's going to happen when they're having intimacy with a partner.
Whenever needed.
Exactly.
For sure.
So no, I think also, the sort of benefits for some gentlemen that are experiencing lower urinary tract symptoms as well. So it might be, getting up to go for a pee a few times in the night and things like that. And actually, one of the benefits that, that happen if you take it regularly over a longer period of time, you get to sleep through the night without having to get up and go to the toilet as well.
Sleep is improved, and that has so many more benefits. And then you've got, of course, the lower urinary tract, or LUTs, we call them in the medical field, don't we? Improving for someone, and in that context, we're talking about BPH, like benign prostatic hypertrophy. It's
big prostate.
Big prostate. That's been well documented in the literature to not eradicate that, but slow down or reduce the symptoms of that actual condition. But then you've got other things like as the improved cardiovascular outcomes for people on low dose PDE5 inhibitors like Tadalafil. So it improves the endothelial lining of your blood vessels.
So reduce vascular inflammation, essentially.
Yeah, so you get less of that sort of, you get an improved lining of the inside of your blood vessels, so you get less turbulent blood flow, reduced likelihood of clots building up around those areas. The regenerative effect it has at a cellular level there is only beneficial. It's like, as I say with everything, the dose is the poison, but please don't think taking more makes it better for your cardiovascular health or your erectile function. There's a critical mass for everything.
Absolutely. And I think the other thing that I'm often surprised about as well is when guys come and talk to me about erectile function and that, that it's been a concern. And I think I always say, have you spoken to your partner about this? And I'm always surprised when sometimes they'll say no.
Yeah.
Because actually, when you kind of try and unpack some of that, they felt uncomfortable about it. They've then felt that their partner felt uncomfortable, and it becomes a "is it me" issue and things like that. And then you've got a whole bigger
and that can just make things worse, can't it? Because it's already a psychological burden to men, because men tend to associate that with masculinity, and that's part of their whole identity. And that's probably a primal thing that there's some rooting in terms of evolutionary history, but it's not something that is easy to get over, and that's what often is the barrier and why they answer the way they do to you when you ask them that question of just having spoken to your significant other who you may have been with for 20 years and you think you could tell anything, and it's the one thing that they feel like they can't tell them. Because there's always this fear of feeling judged or even acknowledging to yourself that there's something wrong, and that sometimes is scary for guys, especially if accompanied by lower urinary tract symptoms. We know from the evidence that men, sorry guys, are very poor at presenting to healthcare professionals when they have symptoms that they feel are of an intimate nature, when actually that's the time that you do need to go and see people. And
I think actually that's a really, really interesting point that you bring up there, actually, Felix. So I personally feel, as a female doctor, that females are taught to present medically, right? So from early teens we'll be going maybe about periods and about contraception then at some point, and then at some point maybe having babies or trying to have babies, and then the after baby bit, and you'll go for breast checks and smears and all of this stuff, and you're educated in going and seeking help and in building a relationship, not necessarily with your one doctor, because we all know that everybody sees a lot of different doctors.
They change around, don't they?
But guys don't have that.
No,
even the 40s health check.
Yeah, that might be the first time.
Exactly.
So and then if they say, "Oh, now we're going to do a genital exam or a PR exam," for example, that is
not
very
what they
scary to guys. They don't, and they don't know that that's what they're going for, because you get called for this by the NHS, don't you? It's like, it's time for your elderly male check, which
not personally, but
it's like. And they don't tell you what the detail of that is. So if you go into the doctor's office and then they suddenly go, right, okay, we're going to do this. That's super scary.
Yeah.
And people will often avoid healthcare professional interaction because of the fear of the unknown.
Yeah.
And I think we could definitely take a leaf out of how women live, in terms of being more comfortable with the fact that this is not something that is an intimate issue you're sharing with a doctor. It's about your health, and that's super important. But you're right, I completely agree with you. There is a conditioning amongst females versus males as to seeking healthcare about what are traditionally considered as intimate problems. And why that is probably due to the nature of the incidence rates of certain types of disorders that can affect women versus men. But it doesn't mean that we can't raise our sons to be more comfortable with talking to healthcare professionals about that, because it isn't something to be ashamed or embarrassed about. No. It's a problem. Like, you would go to the doctor if you had a cough, no worries, but it should be seen as exactly the same.
Yeah, absolutely. And I think that's one of the things that certainly doing things like this is actually really important. It's important to get guys talking about it. It's important to get guys talking about their mental health as well, and to get them feeling comfortable about going back, because that's the other thing. I mean, sometimes you'll probably have had it yourself as well, where you've spoken to a guy who had that GP appointment where he might have been offered an SSRI but didn't quite go back, and then it's 10 years down the line when they're coming into you and they've seen a bit of Instagram content or whatever, and they finally feel comfortable to come back, but they haven't that gap. There's 10 years lost sometimes.
Exactly. And that 10 years could have transformed them into a point where it's now a massive uphill struggle to get back to where they need to be.
Yeah, absolutely.
But no, I do agree. The importance of getting the message out there via social media formats and things.
Also talking to each other.
Yeah.
Do you know how many conversations? I know. And I think women probably have a bit more. Maybe, I don't know. I mean, I can obviously only have this side of the chat, but I think women are probably better at talking to each other about their own health experiences and stuff. Maybe
I would for sure agree. Coming from a female-dominated profession, women are very comfortable talking about their hormones, their menstrual cycles. Even to me, I mean, 20 years I've been in the NHS in a nursing environment where. It is female dominated, and that's one thing I completely agree on. In the break room, women will talk about anything, and it's great to see, because it isn't anything that everybody else doesn't do. We all our bodies work the same. Everybody, it shouldn't be. There should be no stigma attached to it, and I think women are a great example to men of being able to normalize conversations around health.
I have to say, I mean, I don't know. I suppose coming now into what I've seen since coming out and working in private practice and working in Eden Clinic, it's been really beautiful to see some guys coming in and booking their colleagues' blood tests to go and get their hormones checked and everything. I'm like, yes, I love this. This is brilliant. Even if you just have that awareness and just so you've got that stopgap, you felt fine, had that blood test, you know what it looks like, what normal looks like and stuff. But also just doing that check for your friend who it seems a bit low or a bit socially withdrawn or whatever, just putting those feelers out and everything. You can't undo the fact that you didn't have the same amount of touch points with your GP as other people might have done, but actually you can look out for each other and stuff.
For sure. And I think that's something definitely that's worth more conversation around, because they talk about this in emergency medicine, where I obviously work in that arena as well as HRT. And they call it emotional check-ins, and it's talked about a lot because, anybody who works in healthcare, be it private or NHS, but particularly in acute settings, we see a lot of stressful stuff. So they're big on that. And I think that's something that needs to be transferred into everyday conversation. Like, check on your mates. Are they okay? If they've been quieter than normal, drop them a text, say, is everything all right? Because it might be that one reach out that makes them go, do you know what, actually I feel like this, and that might lead to them going and getting checked and then finding a solution to problems that they perhaps knew there was something wrong but didn't know that was the problem they had. It definitely needs to be more of that.
I mean, it is good though, and that's why I think I've previously spoken about, you see guys reaching out with sort of questions that on forums and things about their TRT or whatever, and it makes me a little bit uncomfortable, but at the same time it's great that there are these. And actually, particularly also looking at some other content that goes out on Instagram and YouTube and everything, where actually it's just opening up big questions and putting things out into into the field so that everybody can get involved with the question. And it's sometimes for some people a bit more easier to do.
For sure, interweb. And I think they call that, don't they, in the literature, normalizing the abnormal.
Absolutely.
Which is something that I think in this context, we as men need to be better about checking in on each other and actually just feeling comfortable saying things aren't right. And doing something about it, and that being a totally acceptable course of action.
Yeah, absolutely.